So the Journal of Interventional Epidemiology and Public Health, acronym is JIEPH, was started in 2018 in November. It was started by the African Field Epidemiology Network, AFINET, with the aim of creating an in-house journal that would be able to document the evidence, the massive evidence that the network generates from its programs, the residents who are the trainees, the different projects that are undertaken, and be able to disseminate it. So we are an online journal, we are peer-reviewed, and we are open access. We are an online journal to eliminate the barriers that come with paper-based or published, hard paper-based journals, which require for you to be able to access, you need to pay for it, you need for it to get into your mailbox. With our online platform, it's almost instantaneous. The moment we publish the article, you're able to access it. So that's the beauty with online. And also the submission of the articles by the authors to the journal is faster because it's done online. And we are now in a digital age. Then we are peer-reviewed because that's the standard practice in the industry. Whatever literature you publish needs to be critically assessed by people with expertise in that field to give it a credibility. And then why are we open access? Open access means that whatever we publish can be accessed by anyone who has access to our journal. And since it's an online journal, as long as you're able to log on to our journal, onto our website, you'll be able to access these articles without having to pay. So by it being open access, it means whoever would love to read our articles is able to do it without having to worry about the money barrier. And then on top of that, we don't charge article processing fees. So what this means is that as an author, when you submit your paper to us, you don't need to worry that once we accept your article, which is the typical procedure in most of the journals, you then receive a bill, an invoice. You're going to pay so much, so many dollars or pounds for us to actually publish your work. Now at JIEPH, we don't do that. Our publisher, who is AFINET, picks up that bill. So our authors have access to a journal where they don't need to pay for their work to be published. And then the readers don't have to pay to be able to read its content. And this is in line with our mission as a journal, which is to build capacity to generate evidence, public health evidence from Africa and disseminate it to the rest of the world, but maintaining that context specific to Africa, to fellow Africans, and to the rest of the world. So why this is important is to allow the African epidemiologists be able to tell their story using their own platform. We are in our 5th year since we were started in November 2018. So we are currently continuing with our celebration of 5 years of JIEPH. So within these 5 years, we've been able to publish 7 regular issues. Each year, we publish what we call an issue. And the regular issue is the volume that we open up at the beginning of the year, and we're able to publish different articles, and we close it out at the end of the year, which is December 31st, we close that issue. So that's that volume. So that is what we call the regular publications. So we've had 7 of those. Currently, 2024, we are publishing the 7 regular volume for the journal. But on the other hand, we also publish special supplements to cater for the needs of different authors or our target audience, who are largely the field epidemiology training programs, as well as the different projects that we implement as affiliate. So to date, we've published so far 7 special supplements. Majority of these are coming from our programs. Our maiden special supplement was from the Liberia Field Epidemiology Training Program, and that was way back in 2021. And since then, we've gone on to publish a special supplement for the West Africa Field Epidemiology Training Program. That one was a French supplement. It was really in the French language because the training programs were French-speaking programs. So that was our first go at publishing in French, and was a good challenge. And since then, I think we've been able to take on then another special supplement from the West Africa Health Organization. And this one was spearheaded by the Ghana Field Epidemiology Training Program in collaboration, I think, with the West Africa Training Program. So given its nature, it was publishing work from the ECOWAS region, which speaks both English and French. So for that particular special supplement, we had both English and French articles. The most recent supplement that we published is from Rwanda. And again, this is able to tell the story of the Rwanda Field Epidemiology Training Program. A variety of papers have been published, ranging from maternal health, HIV, and we all know how Rwanda has done an amazing job with addressing the HIV epidemic. So they are able to tell their story in that supplement. And currently, and besides that, we are all aware, 2019, towards the end of 2019, we started hearing rumors of COVID-19. 2020, it was a full-blown pandemic, and it changed the world, and it changed JIEPH as well. We took on to publish a special edition, a special supplement on COVID-19. At that time, we envisaged would just have one volume, but the pandemic went on and it's continuing. So we've run 3 series since 2021, another in 2022, and then 2023 we closed out. So under the COVID supplements, the different programs have been able to share their experiences, and it's amazing the amount of work that has been done around IPC guidelines, risk factors for healthcare workers, our field epidemiology training residents sharing the experiences, particularly like that article that talked about the perceptions that the residents had in those early days when they were being deployed to respond to COVID, with all the fear that surrounded COVID-19. So we're able to capture that story. And years to come, it's going to be documented. When other pandemics come, they'll be able to refer to that article and other articles within these supplements to understand how the FETPs and the rest of the projects within Affiliate were able to work around responding to COVID-19. So really, and then in the regular issue, we really publish about anything that has to do with field epidemiology and public health. So you'll find articles typically on outbreak investigations, Lassa fever, cholera, measles, polio, food poisoning, the typical outbreak investigations that you undertake as an FETP resident. And then we also have some interesting ones, once in a while, we'll get an article that is looking at something maybe around road traffic accidents, That's not something that we typically do as FETP residents, but it's a growing burden of road traffic accidents within Africa. So we've published, I think, an article or two on that. And some of the articles cover are methodological. So again, I would encourage our residents or people who are practicing public health or field EP that, visit our website, look at our articles. You'll be able to learn some of the different methodologies of investigating outbreaks or being able to address some of the typical challenges and experiences we incur as public health practitioners or field epidemiologists. The sole reason why JIEPH was started was to be able to document the evidence that is being generated within the Affinate network. So our desire is not just to have this evidence seated within that journal. Our hope is that by us publishing this in a peer-reviewed journal, we are making this credible evidence accessible to researchers, to field epidemiologists, to public health policymakers out there within Africa and beyond, to be able, when they are doing their literature review, because before you undertake any study, or if you're developing a policy, one of the main things that you're going to do is conduct a thorough literature review. So by JIEPH documenting evidence from the FETPs within the network, we are contributing to the body of knowledge when practitioners, policymakers are doing literature reviews. Our articles are able to pop up because we are, you can find us on Google Scholar, you can find us in Africa Germans Online for now. So at least, given that we're in those two bodies, our articles are able to pop up. But I think it's quite early days for me to be able to pinpoint and say this particular article has contributed to this policy or this practice, because literature shows that it takes about 17 years for evidence to move from research into clinical practice or public health practice. So what we are doing right now is build that body of evidence, and time will tell. I believe that years to come, many of the articles that we are publishing today are going to be translated into practice, into policy. But stepping back a little, the work that we publish, given the nature that most of it is done by field epidemiologists, this work is done to address an issue. So by the time the articles are being published, oftentimes public health interventions have been implemented. And what they are doing in these articles is document and say, this is what we were able to do based on the learnings in the field, and then share with the rest of the world. Scientific writing in the world of field epidemiology really lies, the cornerstone is collaboration. There is no field epidemiology project that is done by an individual, a sole author. By nature of our work, field epidemiologists work in teams, drawing on different expertise. So again, as JIEPH, one of the things we foster are our authorship goes beyond one person. I don't think we would accept a sole authorship of an article as long as it's field EP, because that would be a breach. Collaboration is really the cornerstone of field EP. Secondly, the work that we do as a journal really taps into collaboration. As the managing editor of the journal, there is no way I can carry the weight of the journal on my own. I rely on a team of editors, associate editors, a vast team of reviewers. Many of them are field epidemiologists, they are public health practitioners within our programs, within the ministries of health, within our affiliate organizations, within Africa and beyond. We also rely, our authorship base is again vast. So as JIEPH, I think Tefinet was spot on choosing this theme this year. And I just want to encourage our authors that collaboration is really the cornerstone. And even as they do their work, as they are writing, they should remember when they were implementing their research, they did it as a team. So also as they write, they need to remember to bring on board their different co-authors, especially when we share feedback, the reviewer's comments and the editor's comments. The corresponding author, the primary author, needs to be mindful that this article is owned by the co-authors as well. So they need to collaborate with their co-authors in shaping their article by responding to the comments from the reviewers and the editors. And most of the good articles that we get that have a short turnaround time from review to publication are those where you have a very vibrant and collaborative author set. So I'll just speak to our authors and encourage them to make sure the collaboration continues through the journey of their writing until the article is published. Take care.